All right, so we can go ahead and begin. Uh, Welcome everyone to today's shadowing session. We have Dr. Jenny Jeon today with us, and she's a specialist in pediatric dentistry, and she'll be talking about children's dental health awareness today as well. So welcome to our channel. Thank you so much for being with us here today.
Awesome, thank you so much. I'm actually not in pediatric dentistry, I'm in orthodontics. So I'm a chief resident at UCLA Orthodontics. I am going to talk to you today about how to get a beautiful smile from birth to adulthood, from a dentistry and orthodontics point of view. I'm currently at UCLA. I'm actually at UCLA at the moment. I just got done with a surgery, or at least just monitoring the surgery. And so I'll tell you guys about myself. I was born in South Korea. I moved to SoCal. I moved to Loma Linda first and then to Irvine. And then I went to the NYU BA DDS 7-year dental program, and then went straight to UCLA Orthodontics PGY3, which is just fancy term for third-year chief resident. And here's my family as well. So if you have any siblings, children, or cousins, or any family member really, this lecture will be great for you guys because you'll learn how to take care of your teeth and their future oral health in this lecture. So everyone wants straight white teeth and that perfect Hollywood smile, but why is it important and how do you get there? I think there's a lot of things that we need to learn about that in order to achieve it. So let's first look at some statistics. There's a CREST study done about a survey on people and their perception on teeth. And what they found was people in public-facing jobs with healthy and straight teeth enjoyed 68% better professional success and had 64% better personal financial success, and were considered 53% more trustworthy than coworkers with crooked teeth. And if you look at these pictures, who would you trust more with, let's say, your child and babysitting your child? Would you trust someone with these kinds of teeth or these kinds of teeth? And the answer is probably obvious that you would probably trust someone with these kinds of teeth because it just reflects upon yourself in terms of responsibility, habits, and other things like that. And so a beautiful smile takes a lot of effort, just like fitness and health, which a lot of people are into, losing weight, keeping that weight off. Constant effort is needed, and starting early and preventing problems is the key to success, because we can definitely fix teeth and fix problems, but it's never going to be the same as it was before. And of course, there are some people who say, just get implants and veneers for everything. But implants are not the ultimate option. They're a great alternative to missing teeth, but it'll never be like your teeth. Your teeth are actually suspended in ligaments called the PDL, and this is what kind of makes it a little bit bouncy in terms of chewing. When you chew hard foods, it's not like you're chewing on a nail. These teeth actually bounce a little bit. But when you get implants, of course, there are great alternatives to missing teeth, but they are like a nail in your bone, and so it won't have that same flexibility. So keeping your teeth is the best option, best way to maintaining your oral hygiene and health. Also, a lot of people say, hey, I'm just going to get veneers. It's totally fine. I'm not going to take care of my teeth. But veneers also may develop staining or decay around the margins. The margins is basically where the veneer or the fake tooth structure meets the actual tooth. And a lot of decay or staining can build around these teeth, around the veneer. And so these are not the ultimate option. Your ultimate option is to keep your natural teeth and keep it clean. And so it's very important to start right and start early. So how do you keep your teeth healthy? There's three major components to keeping your teeth healthy. Number one is behavior and habits. Diet, drinking or eating sugary foods or sugary drinks or acidic, very sour foods and drinks will make your teeth erode and more susceptible to cavities. Also, with brushing, it's definitely very important to brush your teeth twice a day for 3 minutes each, and also to use a fluoride toothpaste. Also, there are good and bad bacteria in our mouths, and bad foods such as very sugary or very acidic foods promote cavities because of the bacteria that it promotes. Also, these are more rare, but there are genetics and genetic disorders that could cause softer teeth. For example, in this picture, we can see an example of the Myelogenesis Imperfecta. This is when your enamel doesn't form in a proper way, and so the teeth are a little bit. We can already see that it's stained. And this is actually the inner portion of your teeth coming through because the top layer hasn't formed correctly. But these are more rare. This is about 0.05 to 0.1% of the population. So let's look at how you can keep them healthy. Diet is key. Going to less processed foods and eating more veggies and fruits will definitely help you. Processed foods such as like sugary, sticky, and sour foods, any of these candies, sodas, they're going to promote bad bacteria and more acid, and they're going to break down your teeth. Also, brushing 2 to 3 times a day for 2 to 3 minutes is very important. We want that fluoride in the toothpaste to work. And how fluoride works is it actually kills the bacteria and it actually makes the enamel stronger. So it's a dual effect. Also, going for regular checkups every 6 months, especially when the first tooth erupts and subsequently after that, is very important to make sure everything is going the right way. And a lot of people say, hey, it's just a baby tooth. We can get rid of it. It's fine. These are just training wheels. We'll just get it extracted and the permanent teeth will erupt. The reality is when baby teeth get decayed like this and they extract it, meaning they remove it, what happens is the space doesn't get maintained. And so the adult tooth here is going to start caving in like this. In this x-ray, this adult tooth already has a huge cavity filling in it. And so when this tooth starts caving in like this adult tooth does not have enough space to come in. And so that poses a lot of problems in the future, and they have to get what we call an expose and bond during their orthodontics and their braces, and it takes a long time for this tooth to come out, or we may have to extract this tooth because there's just no space available. So if you were to go to a pediatric dentist, they will put in a space maintainer like this if you lose that tooth earlier on. And so this space maintainer will hold that space until the permanent tooth erupts. So number 2, how do you get straight teeth? You have to visit an orthodontist, of course, who specializes in straightening teeth. And the right time for an orthodontic checkup is no later than age 7. And why is it no later than age 7? Because not very many 7-year-olds have braces. There are some serious problems that may need to be treated early. So these are pretty young dentition, young teeth, let's say. And there are these kinds of problems that need to be fixed earlier on to prevent more severe problems from developing. Here we can see an anterior crossbite where this lower tooth is jutting out. It should be tucked in under the upper teeth, but this one's being jutted out. There's a little bit of recession starting to happen, meaning the gums are receding. Here we can see a posterior crossbite where the upper teeth, the molar should be actually outside of the lower teeth. However, on this side, you can see that they're caving in like this. And so when these problems are not fixed when they're young, their lower jaw actually may shift and they may grow asymmetrically in their lower jaw. I'll show you a example of that later. Extreme cases of crowding can also warrant orthodontic monitoring. Here is an example of an open bite. This may occur if you're sucking your thumb like this, or just digit sucking, finger sucking, pacifier using for too long may also develop these problems. There's also protrusion. This can also occur if you're sucking on your thumb as well. You can kind of imagine with me here, the thumb going into the slot. And so that's just how the teeth end up growing into. Here, ectopic eruption, that's kind of when the teeth erupt in a abnormal area. This should be a little bit further behind, but it's coming in front. Here's a classic underbite. Underbites, they can be corrected early on, or they can be corrected later on with jaw surgery. Here's a diastema, just gap between the two front teeth. This may be normal, this may be abnormal. It's up to the clinical exam. So here is an example of what I was talking about before. So if you have a crossbite like this, and the upper teeth are not overlapping the lower teeth, what can happen is the lower jaw may grow asymmetrically if the crossbite is not fixed when the patient is younger. So here you can see an example of an adult patient with a crossbite, and most likely her problem started when she was a young child, and it was never fixed. And so the jaw kind of adapts to the function of how she chews, how she rests. And so that's probably why she developed this asymmetrical jaw. Also, habits need to be checked. Thumb sucking, pacifier use, or tongue tie, lisps, tongue thrusting. Here's an example of a tongue tie where the attachment between the floor of the mouth and the tongue is not long enough. And so this patient will probably have a tongue thrusting upon swallowing, where they thrust their tongue in front instead of pulling it up above the palate, the hard palate. And so this can actually lead to a whole host of problems in terms of the teeth and the bite. Also, here you can see the dangers of thumb sucking. It may seem benign and cute, but when they suck on their thumb for too long, that imprint of the thumb is basically left in the teeth, where there's a space between the upper and lower teeth. And so if this persists for too long, they may not be able to bite into sandwiches, bite into pizzas, things like that. And also it may affect their speech as well. Also, mouth breathing is an issue as well. And you may ask, why mouth breathing? Why is mouth breathing so bad? It's okay if you're just breathing and gasping for air after you've run a mile or anything, but perpetual mouth breathing where you cannot breathe through your nose, it becomes a problem because it alters the way your jaws grow. When you have your mouth open all the time, the teeth erupt excessively, and especially your molars erupt excessively. And so what will happen is the lower jaw will grow downward and backwards. So here we can kind of see the pathway of facial development. The normal child will grow, just like this. However, when they are breathing with their mouth open, and this is untreated, what will happen is their lower face will become longer because the molars will start to erupt. So teeth actually erupt until they meet the other half on the bottom or the top. So when you're perpetually open mouth breathing, those teeth will keep extruding, erupting more and more. And so when they erupt more and more, the lower jaw and the upper jaw become longer, and they end up with this long-faced profile. You can also see it here as well with kind of a retrusive chin, like a backward chin. So when should I get braces? It depends. If early problems exist, like the ones that I mentioned before, you may have 2 rounds of treatment, where the first round of treatment treats early problems. And it may be through expansion, it may be through extraction. So we can expand or extract to make some space for the teeth. Or we can do other things as well, but I won't get into that here. And phase 2 will be to get teeth and the bite into alignment and harmony. And this can be done through braces or clear aligners and other things as well. And if no early problems exist, then teenage years is usually the best option because that's when all of the permanent teeth have erupted, and this is when it's socially acceptable to have braces. And usually the patients don't have any gingival, any gum or bone problems. But if there is a severe jaw discrepancy, like the one that you see here, this patient is actually a class 3 skeletal malocclusion. What that means is he has a severe underbite. And that's because his upper jaw is too small and his lower jaw is too big. And so in these kinds of cases, we don't treat them early. And you may say, why? It's such a severe problem. But in these kinds of cases, the patient will keep growing. So until he stops growing in his height, the mandible, the lower jaw, actually follows the height growth. And so usually when he stops growing, we will start the braces to get the teeth into the bone. So we'll actually make the underbite worse before the jaw surgery. And the jaw surgery is what I just came back from, and that's why I'm still in scrubs right now. And so what we'll do is we'll set all the teeth to the bone and then get him to jaw surgery. The jaw surgery will actually correct the underbite problems. And then after that, we'll tweak a little bit more with the braces, and then we'll be done with the whole treatment. But this will usually happen when they're about 18, 19, 20, in that range. Also, it's never late to get braces. It's never too late to get braces. I have a patient who's 68 years old and he's still getting Invisalign. He's one of my best patients. And as long as your teeth, your gums, and your bones are healthy, we can definitely align your teeth, give you a better smile, and just a more improved quality of life as well. So that's actually it. I realized that was a little bit short, but if you have any questions, I can actually pull up more slides if you guys want. But are there any questions at the moment?
The question should be in the chat. If you click on the chat box, you should see them.
All right. I see the question. Right. What are the best things that we can do to keep our teeth healthy? How has COVID affected your work? Great. So yeah, the best things that we can do is, number 1, keep up your brushing. Use fluoridated toothpaste, and anything sugary, sticky, anything honestly processed may have a lot of sugar in it. And probably the worst thing for your teeth is Sour Patch Kids. It's sticky, it's sour, and it's sugary. But I know it's good, but if you must have them, then make sure that your teeth are clear of those sticky substances after you eat, as soon as you eat it. So I recommend to chew sugarless gum, or even better, chew xylitol gum. And that will actually help you clear all of that junk out of the grooves of your teeth. And it'll actually stimulate saliva, which actually has calcium in it. And so the calcium will remineralize your teeth, and that is how you can also prevent decay. How has COVID affected your work? It has definitely affected our work because it has reduced the number of patients we can see. And so when we go to work, We are seeing about 60 to 75% of the capacity now because we can only use every other chair. And also some patients don't want to come in because of the fear of getting COVID. Do products or treatments such as Invisalign work as well as braces? Great question. So I would say that Invisalign is a great tool and we use it all the time. There are certain problems that are better treated with Invisalign versus braces. There are better cases that braces can treat. As a general rule of thumb, root movement, as in if we need to move the root of the teeth, we usually like to use braces because braces still have a little better control of the teeth. Whereas clear aligners, they don't really move the root very well. But there are other instances where clear aligners will actually do a better job than braces. Let's say open bite cases. Those are usually the cases that we want to treat with Invisalign, mild open bite cases. What percentage of patients come in for care due to a sports injury? Not too many for orthodontics, but maybe to pediatric dentistry or to general dentistry. I've seen cases where, you know, a patient just got caught in a volleyball net and one of their front teeth just came out. And so in those cases, yeah, they'll call us up or things like that. Actually, braces, it's funny because it will actually prevent against that because it splints all the teeth together. And so actually my sister-in-law, she actually had braces when she was in high school and she had an accident where she fell and hit her teeth against the table like this. And she said that her teeth were a little bit mobile, they're moving a little bit. But I told her, you know, if you didn't have the braces, you probably would have lost at least a tooth, and that tooth probably would have been on the ground with you. So that's actually one pro of, I guess, having braces. What was the worst case of cavities you've seen in children? Which age has the most amount of problems with gums and teeth? So the worst case of cavities that I've seen was actually at an outreach in Grenada. And this was during my dental school days. And they just had cavities on every single tooth, where we had to just basically take out all the baby teeth, which we don't want to do, but in those situations we'd have to do because we just don't have the necessary resources and follow-up to be able to treat them properly. So we did have to extract the baby teeth. And also the permanent teeth also unfortunately had cavities as well, which is probably the worst part. So we were able to fill those just so that we can mitigate all the problems. Which age range has the most amount of problems with their gums and teeth? I would say with their gums, it would be older because they've had more time to accrue more problems. And so when you look at patients who are you know, in their 40s to 60s, even into their 80s, they will have a lot of missing teeth, they will have a lot of bone recession, gum recession, and they will need a lot of extensive treatment in order to get teeth and dentures in order for them to chew properly. What are the differences in training to be an orthodontist compared to a general dentist? So orthodontists are general dentists by training. So you have to go through 4 years of college or 3 if you're fast, and then 4 years of dental school. And after dental school, you'll become a general dentist. For an orthodontist, you have to go through extra training. And that extra training is usually about 2 to 3 years. In UCLA, we are 3 years. And we also get a master's degree on top of the certificate in orthodontics. What are some of the most common procedures? In orthodontics, I would just say usually crowding, just relieving crowding. The patient will just come in with a chief concern of my teeth are crooked. And so there are two ways to treat it. We can either expand to make space, or we can extract to make space. So those two are probably the most common. How long did it take you to become an orthodontist? What is it like to work in your field of medicine? So starting from high school, well, I actually went through an accelerated dental program. So instead of the 4 years of college and 4 years of dental school, I shaved a year off from the college years. And so I was able to do that in 7 years, but usually it takes 8 years. And then 3 more years of orthodontic residency. And so total, that would be 10 years for me, but usually it's 11 years. What is it like to work in your field of medicine? It's honestly amazing. I chose this profession because it's great. We get to see children, we get to see adults, we get to see teens, and we develop a friendship with them over the 2 to 3 years that we're in treatment. And so we get to see them transform. We get to actually know them as a patient, a friend, and you know, it is kind of like sending your kid off to college when you graduate them from braces or Invisalign or jaw surgery. So it's amazing. What are clear signs that you have cavities? How often should I brush a day? So some clear signs that you have cavities can be staining. If it looks brown, black, and it looks like there's a hole there, then it's pretty, you know, clear that you do have cavities. But there's also more minute signs that you can look for. If you, let's say, drink a very sugary drink and you feel a little sensitivity in your teeth, especially on the tops of your teeth, you may actually have a little bit of like cavities starting to form. And I always monitor my teeth as well. If I'm drinking something super sugary and I feel that sensitivity, I go in there, brush really well. I give myself some fluoride varnish, which is extra fluoridated gel that you can actually have your dentist apply for you so that your teeth will remineralize. So if your cavities are not that extensive, what you can actually do is you can reverse them. And this is only if they haven't cavitated, meaning there's not a hole created yet. So in those cases, you can actually apply some fluoride, re-harden that enamel, and still be okay. So definitely preventing those from happening by going for general cleanings every 6 months and getting fluoridated toothpaste if needed. There's also prescription toothpaste that you can get from your general dentist, and you can actually ask them if you can be a candidate for that as well. And those are ways that you can prevent cavities. You should brush twice a day for 2 to 3 minutes. And the reason why you have to brush for 2 to 3 minutes is not only because you have to reach all the areas. I can trust that you can get all the areas in less than a minute, but you need that fluoride to work on the teeth. And the fluoride has to exchange in terms of, the fluoride basically has to be absorbed into your teeth. And so we need time for the fluoride to be absorbed onto your teeth. And that's why we need 2 to 3 minutes of brushing. What are the difficult areas when treating children when compared to adults? Yeah, children can be very uncooperative, and you may have to, you know, spend a lot of time talking to them before showing them, explaining to them before you start doing the procedure. And so it may take more time, it may take more patience, it may take more talking to before you start procedures. But what I've noticed is adults are just like children. I don't want to say that in a demeaning way, but when everyone goes to this, you treat everyone as if like a child, but in a way that you are synthetic. It's always a good policy. If you had to start or orthodontist, if not, what would you do? What are some things you wish you knew before getting started? So I kind of had a good tip from my mom and dad. What is an orthodontist, and my dad is a plastic surgeon, and so they have both experience and the medical side. That to decide a little bit more clearly as to what I think. If I over, I was very interested going into medicine as well, but the amount of residency and training that it requires to go into medicine, dentistry was from 4, if not up to 6 years of training. I think a lot of people don't know that going in, and on top of that, usually people decide to do fellowships, and so that will add another one. So the training becomes medicine, and so that's because 3 years of school and then orthodontic, and I'm able to work orthodontist. So that's why I and orthodontist. You you also earn a lot of money as well. So we just amazing. You honestly never.
Hey, Dr. Jenny. It looks like you got disconnected. We can't hear you at the moment. All right, so we're just gonna give her a couple minutes to see if she can reconnect. In the meantime, we did post our Google Forms link. So you can go ahead and fill out the form and submit it. Let's see. It looks like she's about to come back.
Okay, can you hear me now? Sorry about that.
Yeah.
Okay, great. So let's see where we were. How does your schedule work as a I'm guessing orthodontist? Do you have long hours? What is the most amount of cavities you've seen in one patient? So how does your schedule work as an orthodontist? Right now I'm an orthodontic resident. I'm a chief resident. We see about 6 patients a day, and that's usually due to the fact that COVID has reduced our numbers. Let's see. Let's see. What are common procedures are hard to deal with? But I would say that the most complex cases are jaw surgery cases and actually craniofacial cases. So a component of orthodontics that we have is craniofacial anomalies, and one of these include palate, hemifacial microsomia, all of these craniofacial anomalies that affect the face. And those patients require like a team approach with a plastic surgeon, check, and pediatrician. Probably the hardest cases, but actually the most rewarding cases because they undergo such a transformation. Let's see. What is the most interesting part of your job? I would say interacting with the patients and having them just, tell me about their day, or if there's like a very funny patient that comes in, that always lights up the day. Yeah. And honestly, today I was dressed in a jaw surgery, just observing one of my patients getting jaw surgery, and that's honestly very interesting to me, to be able to see all of the teeth that I've put into place be fixed with jaw surgery. And now I'm going to see her in about a month and see all of the amazing transformation that has happened through surgery. Does mouth breathing really affect the affect alignment of your teeth? Because it ends up your molars ends up extruding more, and that's basically because the mouth is constantly open and the teeth tend to want to extrude, meaning come out until it meets a partner. And so it really does affect your teeth, even though it seems very far-fetched. Trust me, everything is interconnected. Your soft tissues, meaning your face and your muscle and your skin, also affect how your teeth are positioned as well. So all of those things are, well, don't know, but you've learned today. Do you treat cavities in milk teeth? Why so? Wouldn't they just fall out? So yes, cavities in baby teeth need to be treated. And the reason is that if you extract them, if you just, even if you just let them fall out on its own, if the cavity is deep enough, it can actually affect the adult tooth. And you don't want your adult teeth to be affected by cavities on just baby teeth. Will be occupied. The permanent teeth or the other teeth will start to cave in, and the space for the permanent teeth will start to diminish. And so because of that, you want to keep your baby teeth in and healthy as much as possible. Do hard foods impact tooth health? Yes. Chewing on ice, chewing on gobstoppers, jawbreakers, all of those things definitely impact tooth health. Teeth are basically crystals. Enamel is a crystal, and underneath that is dentin, which is a semi-crystal, semi-collagen, as well as other substances. But in essence, it is a bone-like structure. It's definitely harder than bone, but it is breakable. And if you use your teeth to crack open, those bottles and things like that, your teeth can break and can fracture. So do not do that. Try to save your teeth as much as possible, because they're the tools for you to speak with, to eat with, to smile with, and all of these things. What is the best part about your practice? We've covered that. What was your process to becoming an orthodontist? How long? We covered that as well. Did you ever find yourself in a difficult position with your job? Of course, I think that is a problem that you can face in any occupation. You know, it could be anywhere from the patient being the problem, or your colleague being the problem, or your staff being the problem. And so just being a good human being with good social skills is definitely a must in being a clinician, a doctor, and all these things. Did you consider any other specialties besides orthodontics? What is your favorite procedure? Yes, so I actually considered pediatric dentistry as well as oral surgery. I love all of those procedures. I love dealing with children. So it was a little bit hard for me to decide whether or not to go into pediatric dentistry or orthodontics, but I like orthodontics because I get to treat not only adults, but also children as well. So I think that was partly why I chose orthodontics. And orthodontics versus oral surgery, I liked the lifestyle of an orthodontist more than an oral surgeon. I love surgery as well. That's why I go into these jaw surgeries and observe. But at the end of the day, it does take a huge toll on your body, and it also takes a toll on your personal life and time as well, because there's a lot more emergencies in oral surgery than in orthodontics. And so I think all things considered, I chose orthodontics for the career, for the lifestyle, and for just my future as well. Just wait until this gets up. What is the most dangerous question? So what is the most dangerous food or drink? I would say sugary soda. I think out of all of them, Mountain Dew kind of has a bad rap. But anything that is sour and sugary, even like lemonade, you think it's juice, you know, orange juice, you think it's great because it comes from a fruit. It is actually not that great for your teeth. So acid erodes your teeth. Acid actually erodes anything. And so what happens is the sourness is actually acid. And so when you drink substances or eat substances that are acidic, it actually degrades your enamel ever so slightly. And when those occurrences repeat over and over again, that's when your enamel will erode, and it will basically start cavitating or just stripping off your enamel. Also, sugar. Why is sugar bad if it's not an acid? So sugar actually promotes bad bacteria. It's called Streptococcus mutans. And this bacteria actually feeds on the sugar that is on the surfaces of our teeth. And after it consumes the sugar, it basically poops out, or it excretes acid as a byproduct. And so these bacteria thrive on sugar. They create all sorts of little plaque, basically communities of bacteria, and then basically poop out or excrete acid onto your teeth. And that is how you end up getting a huge hole in your tooth, because over time that acid will continually eat away at your tooth, like bang away or just erode at your teeth. And so over time you'll get a huge hole, and that hole is what we call a cavity. Can a person have good dental health throughout their life without getting braces? Yeah. There are certain people who never have to have braces, but they have excellent teeth, and they have excellent oral habits. Actually, when our ancestors long time ago, they had enough space for all of their teeth, including their wisdom teeth. But as the human species has evolved, the jaws became smaller as a result of the diet becoming softer, from using fire to break down our food, to cook our food so that we don't have to chew as much. And so because our jaws became smaller, but the number of teeth did not decrease, that is one of the reasons why we get a lot of crowding or crooked teeth. So in certain people who may be missing wisdom teeth or may have enough space for their teeth, they may have a beautiful smile. One of my friends, they've never had braces before, but they have a beautiful set of teeth, beautiful white toothy smile, and is a great looking dude. So yeah, it is very possible. I think that is all of the questions.
Yep, it looks like it. Thank you so much for answering all those questions in your awesome presentation. I definitely learned a lot from your presentation today for sure. And
Awesome.
yeah, so thank you so much. And everyone who's still watching, just make sure to turn in your Google Forms to get your shadowing hour by 9:35 p.m. Eastern Standard Time. But yeah, so